Hi, I'm Dr. Chuck with Your Filthy Mouth. Today we're going to be looking at an article that talks about 57 different diseases associated with oral bacteria. It's a big deal. Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, welcome to Your Filthy Mouth. I'm Suzanne Lynn with Dr. Chuck, and today, we're going to be hitting some really important information about how what's happening in your mouth is truly affecting your body in ways that they're just now discovering, right?
Well, we've talked about how oral infections affect your heart, how affect the strokes, affects diabetes, affect Alzheimer's, affects pregnancy complications, affects rheumatoid arthritis. Now they're finding many more things that the bacteria from the mouth as it gets into the body are affecting. Some of these you wouldn't even think of. Something like indigestion.
Really?
Indigestion is linked to some of the bacteria that we have in the mouth. As it gets into the stomach, our bodies react to it in different ways.
So let's back up a little bit. When you talk about, before we start talking about the different diseases, what is it in your mouth that's exactly causing all this? So what's causative? Yeah.
Well, everybody has bacteria in their mouth. If we didn't have the bacteria, we'd be sick. So we need good bacteria, but we have also harmful bacteria, some bad bacteria. Whenever you have bacteria in your mouth, your body is trying to fight off the bad bacteria, and you have something called inflammation. And that's when your gums bleed real easy. Well, wherever your gums bleed, there's a hole where the blood came out. They've shown that the bacteria can go right into that hole and get into your bloodstream. So this is all different kinds of bacteria. When you have an open door, who knows who's going through the door?
And you don't know if you've got it, right? There's a lot
no
of
pain.
openings.
That's
right?
That's the biggest thing, right? The older I get, the more I like pain. Pain is a wonderful motivator.
Yeah.
But lack of pain doesn't make people take action. So
this bacteria in our mouth is going into your bloodstream, and it's causing, in addition to these, things that you talked about, arthritis?
They're showing that it affects, Ankylosing Spondylitis, which is a form of arthritis that goes to the spine. And it can cause a lot of pain. You think arthritis in the spine from oral things? Yeah, this is what. So it's there's way more than we can even imagine. So it's the front door of the body. We have the three P's where our exits. We pee, we poop, and we perspire. Okay? We got the three P's right there. But the entrance comes right through our mouth. This is where everything is coming in, and we don't even know what all we're getting in our mouth. That's especially today, the air we're breathing, the water we're drinking, the food we're eating.
I never thought about that.
Yeah, there's all kinds of different, what's really coming into our mouth, and it's hard to keep track of all of it. There's so much.
It is. I mean, for example, today we had the bug guy come and spray, and you can't smell it, you can't see it. It's supposed to not bother the animals, but you wonder, what are we taking in? What are all these chemicals?
And those are the things we don't know.
Right.
Okay. Right. So the best thing we can do, and that's what I focus on, what we can do is we can keep the mouth as healthy as we possibly can. If we can shut down the open door, if we can get rid of the inflammation, if we can not let it bleed, now we've decreased the number of paths that the harmful bacteria has to get into our body.
Okay.
So, my thing is, let's head them off at the pass. Let's take care of it before they get in. Otherwise, like they say, it's affecting so many areas of our body that we don't even know. One of the biggest problems is we have no symptoms. That's what we say, there's no pain, but we might not have any other symptoms, and this can be going on for weeks, months, literally decades, and you don't know it, but it's damaging our bodies that entire time. When you finally get symptoms, and I was talking to a chiropractor, he was saying that the very last thing you get is pain.
Wow, that's a bad place to be.
Yeah, so by the time it hurts.
Yeah, you could have done so much more maybe to, not just heal it, but maybe prevent it early on. So let's talk about some of the other diseases. So arthritis is really surprising to me. What are some other ones?
Well, they don't want to get into all the lists and tell you exactly what it is, because it's, how can I say, there's just a lot we don't know yet, and they say they're associated with these other diseases.
It sounds like legal reasons. They don't want to be very specific.
Yeah, but common sense is so uncommon, and that's what we're trying to help people understand. Common sense says that if you breathe or bring in bad things into your mouth and it gets into your body and it's not helpful to you, it's harmful.
So when they're saying that this is causative of, heart disease, or in this case, arthritis, or, acid reflux, that's what you said, are they finding the bacteria in, is it in autopsies? How are they discovering this? Like, where's the bacteria found, or what's the proof of that?
Different ways. And a lot of them are autopsies after the fact. That's when they're finding them in Alzheimer's patients in the brains. I mean, you're not going to go in the brain while they're living.
Right.
So after they're passed away, they can look and see what's going on, what bacteria is going on in there, and what is this bacteria causing. And that's why in the brain with Alzheimer's disease, they've shown some of the oral bacteria is triggering the production of beta amyloid, which is a bad thing in Alzheimer's disease. So it's after the fact, but for that person whose brain they're examining, it's not doing any good to them, but it's going to do a lot of good for us. So
Science.
it's after the fact that we can learn.
And in the case of pregnancy, they're finding it in maybe miscarried babies.
Preterm, miscarriage, stillborn, that's when they could go in, they can find out, why did the baby die? What's going on? Sometimes the poor baby is full of oral bacteria. And this is where it just, when I was in dental school, we were taught that because we went to the instructors and said, well, what about the bacteria in the mouth? Aren't they going to get in the rest of the body? And said, oh, no, there's an oral barrier that keeps it out. Just like there's a blood-brain barrier, there's a placental barrier. Well, if they're finding oral bacteria in the brains of Alzheimer's patients, there's not much of a blood-brain barrier.
Right.
If they're finding bacteria in stillborns, in babies, there's not much of a placental barrier, and there is no oral barrier. As soon as the bacteria gets into the bloodstream, boop, it goes everywhere. Have you ever been put out for surgery where they put the needle in your arm and say count backwards from 100? Okay.
Yeah.
How far back do you count?
About 99.
Yeah, pretty darn quick.
Right.
Okay? And that's how quick the medication goes from your arm to your brain. That's also how quick bacteria go from your mouth to the rest of your body. It's just seconds. It doesn't take long. It's just a matter of seconds. So if we think it's going to take a long time for it to go from here and kind of work its way through our body, no, it's really quick.
So I don't want to be disgusting or anything, but earlier this week I had a canker sore, and then I just tasted a little bit of pus, and it, must have taken care of itself or whatever.
Right.
The reason I bring this up is because that's now gone through my bloodstream.
That's correct.
So, I mean, it might be something as like a little canker sore or, gum related things. You might not even taste it. This is bad. I mean,
well, your body can keep up with certain things. Okay. But when your body is on overload to where you've just, the amount of bacteria in there is more than your body can handle, that's when you start having some issues. All of us have invaders coming into our body, and we have an immune system that really works good, but that immune system can get overworked, and when it gets overworked, then we have consequences.
So I'm going to die sometime, right?
We're all gonna. That's
right.
That's one thing I said. Nobody gets out alive. That's the rule, okay? But wouldn't it be nice to be as comfortable as we can while we're here? It's not always just the number of years we live.
Right.
It's how do we feel during that time? What's our quality of life?
Yeah.
There you go.
Yeah.
So, but yeah, it's so much of this is choice, and that's the part we're trying to get across. We have a choice every day. Are we going to spend that 5 to 7 minutes cleaning our mouth, or are we going to watch TV? We all have that choice. I know. Yeah. Are we going to eat the third piece of cake or,
make
not,
good decisions.
These are choices. These are decisions every one of us has.
All right.
So they're not always easy, but
they're worth
sometimes they're simple. They're just not easy.
Yeah.
Yeah.
We're going to come back. We've got a question of the week, and then we're going to continue and talk about how maybe we can prevent some of these issues that we're talking about today. Thanks.
Here's Dr. Chuck's question of the week.
Yeah, I'm Travis. I've used tobacco most of my life, and I'm concerned about mouth cancer. Should I be looking for any types of bumps or sores?
Thank you, Travis. We were going to send you, first of all, your Filthy Mouth coffee mug, because if we use your questions when you check in with us, that's what we do. So thank you for that. What are your thoughts?
Tobacco, oral sores. Yeah, absolutely. The challenge that we have is so many of these oral sores that you have no pain. You don't even know they're going on. One of the first things a lot of times you'll see is kind of a whitish wrinkle that goes inside there.
Okay.
They call that precancerous. It doesn't mean it's cancer, but that tissue is much more susceptible of becoming cancerous. So if you look inside and see these whitish patches, it's kind of like the red light is flashing saying, warning, warning,
Yeah.
So you look for those things, but a lot of times, and that's the challenge, you won't feel anything. You won't have any pain. This is why the older I get, the more I like pain, because pain is a great motivator, but lack of pain Doesn't make us
Just keep doing the same
just
thing.
keep on doing it. So yeah, look around inside there, but it's really good to get an examination from a qualified dentist. Have them take a look around. In our office, we use a light called Velscope, and it shows where cells are multiplying faster than the cells around them. So I've had it where I look at a piece of tissue and it looks perfectly normal. You use the light, you look at it, and you can see something growing in a particular area. I would have missed it if I just used my eyes.
Sure.
So yeah, get an examination, and you're doing it not just for you, but you're doing it for your family, for your spouse, your kids. You know, they oral cancer surgery can be very disfiguring. Usually we'll find oral cancer in the mouth once, maybe twice a year. So far this year, we found it 3 times.
Wow.
And so, again, we're finding it small, which is a whole lot better than letting it get big. But yeah, get yourself checked out. That's important.
Thank you. Thanks, Travis.
Yeah.
Well, as we're talking about the different systemic things that can be caused from bacteria in your mouth, let's talk about prevention. Boy, wouldn't that be so much better than, as you've said before, having to have a stent put in, or be on high blood pressure medicine?
Well, this is almost cynical, but I saw a commercial where it had a medical instructor teaching the class, and it says something like, when you cure a patient, you lose a client. Well,
You're all for that, aren't you? Yeah.
I'm all for curing the patient.
That's right.
That's the whole idea.
Yeah.
And so if we can prevent some of these issues, maybe you don't need the stent. Maybe you don't need the heart valve. Maybe you don't suffer the stroke. Maybe you don't have some of these problems. So it's kind of hard to measure when something doesn't happen.
Right.
You can always measure after it happens.
Sure.
And this is why they use statistics to look at this and say, well, in this population, we had so many people that before we did this, so many got this. After we did this, so many didn't get this. So they can look at numbers that way. But I think on an individual basis, common sense should go a long way. The cleaner we keep our mouth, the better it is for the body.
Sure.
But we have 4 things. We have what we eat. That plays a big role. A little bit of exercise. Exercise is medicine. A healthy mouth. And the 4th thing is our attitude. That does play a role in our health. So
And brushing 5 to 7 minutes a day. Goes
1 time a day
long way,
right is better than 2 times a day wrong, or 3 times a day wrong. So yeah, take your time, do it right. Check yourself with disclosing solution. Check yourself. It's amazing how many times we use it on every patient when they come in for the hygiene visits. And they say, "Oh, my teeth are going to be great," and then they look at it and go, "Geez, look what I missed." So we're not trying to make anyone feel bad. We're just trying to educate.
Right.
And there's a big difference between making you feel bad and let's learn. Let's
Absolutely.
learn together.
And that's why we want you to share it with friends and family. Everything that you're learning here, subscribe so you don't miss any shows, because this is life and death stuff in a lot of cases.
Yeah, and it's easy, and dental care is not expensive. Dental neglect is very expensive, and that's the part we want to. What you can do at home for free every day is going to save you not only thousands of dollars, but it's going to save you a whole lot of other irritants. We have a
visitor today.
We have a visitor here.
Right. All right. Well, this seems like a good time to say thank you for checking in, and PJ, say goodbye, baby.
Say goodbye.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.